Hello, my name is Dr. Eric Singhi. I'm a thoracic medical oncologist at MD Anderson Cancer Center in Houston, Texas. Very excited to be invited as faculty this year for the upcoming World Conference on Lung Cancer. It'll be taking place in Barcelona, Spain. Very excited to visit Barcelona to connect with colleagues, friends, patient advocates to learn about the latest updates in lung cancer for our patients. There's going to be really robust discussions all the way from early detection to early stages of disease, all the way to advanced stage and metastatic disease, covering histologies that are quite common, such as non-small cell lung cancer, to less common histologies, including mesothelioma and small cell lung cancer that still have such an important unmet need. There are a few exciting studies that I'm looking forward to hearing updates about in Barcelona. Two of them are going to be actually at the Presidential Symposium. We're going to hear about an updated overall survival benefit for patients on the FLORA-2 regimen, which was a phase 3 study looking at first-line osimertinib plus chemotherapy versus osimertinib alone. We've heard about a press release that this was a positive overall survival benefit for patients who were on the combination arm, but looking forward to learning more about the details, to truly understanding what the magnitude of that benefit is and how it may alter our conversations for patients in clinic today about a combination regimen versus osimertinib alone. There's also another study, the Harmony study, which was a phase 3 study looking at ivonescimab, which is a bispecific antibody against PD-1 and VEGF, versus placebo plus chemotherapy for patients who have unfortunately experienced disease progression if they have EGFR positive non-small cell lung cancer and they've been on a third generation TKI. So we'll get to hear updates on the clinical benefit of a regimen such as this. That covers non-small cell lung cancer, specifically EGFR positive non-small cell lung cancer. But like I said, there are still some really exciting updates that are coming for patients with less common but still very meaningful histologies. So looking forward to hearing about an update in the mesothelioma space from a colleague and friend of mine, Dr. Josh Royce. He will be talking about neoadjuvant nivolumab or Nivo plus IPI for patients who have resectable pleural mesothelioma. So we've heard a lot about just a few years ago about how the landscape and thinking about surgery for patients with mesothelioma is changing. And so this is an exciting update that if patients are to go for surgery with this type of disease, how is immunotherapy going to help patients in the neoadjuvant setting? So I'm really looking forward to that one. And then last but not least, small cell lung cancer. There's always a huge unmet need for patients with small cell lung cancer. And so a colleague of mine, Dr. Lauren Byers, who's also an amazing mentor and sponsor, she'll be talking about an update from the ABBV 706 SEZ6 ADC study, which is a drug that is being evaluated in terms of safety and efficacy for patients with relapsed refractory small cell lung cancer. And so SEZ6 is a very important biomarker in a real-world cohort of patients. It can be overexpressed in upwards of 40 to upwards of even 63% of patients. And so it'll be nice to see how is this drug doing for patients who have relapsed and refractory small cell lung cancer and how ADCs specifically are moving forward in this space. Of course, I've talked a lot about some exciting therapeutic studies and updates that we're going to get at World Lung, but I really also want to put in a plug for the patient advocacy track that I had the pleasure and honor of being a part of this year and helping to plan and organize. There's going to be a really great session that's focused on personalized cancer care from diagnosis all the way to survivorship and what that looks like for our patients with lung cancer. There's going to be amazing chairs. Dr. Hideo Ichimura and Jill Feldman as well will be leading that session. I will be speaking at session as well. We'll be talking about how you can leverage digital platforms like social media to enhance patient education, patient understanding about their diagnosis and treatment options, and how that can also help with advocacy, which is so important as we continue to get more treatment options for our patients. And we really want patients to engage in informed and shared decision making. There's also going to be great interactive sessions that include compassion fatigue and what that looks like for caregivers for patients of lung cancer, and also talking about ways to get involved with policy and survivorship as well. So keep an eye on the patient advocacy track, and I look forward to seeing you there. Really excited about being able to attend the World Conference on Lung Cancer this year in beautiful Barcelona, Spain. It's going to be a really great time to connect with colleagues, to connect with patient advocates, to make those new connections, right? Whether you're looking to learn more about your own research, whether you're looking to learn more about career opportunities, it's a really great time to have those organic connections and to continue to learn because there's so much changing in lung cancer. And the only way to really truly bring those changes to our patients that we're seeing in clinic is by learning from each other, unpacking the details, and discussing it in such an open and collaborative setting. So look forward to seeing you there.